And welcome back to another edition of the Kellum Connect MD.com online video podcast minute. Dr. Kellum, it's been a while.
No, thank God.
How's it been? Thank God it's been a while,
Thank
or
God
thank God we're back? Okay, good. Just want to make sure we clarify.
I sort of enjoyed the break from your personality.
Want to clarify that. How's your start of the school year?
It's been good, actually. All the kids are back in school, enjoying themselves. Things are kind of back to normal as with most everybody else out there, and so I'm sure everybody appreciates the normalcy of the school year again.
Yeah, and kids are starting to come in. It's the beginning of the year.
For sure.
I know my son Xavier, Mom, Dad, I've got a little bit of the cold. And sure enough, he's brought something home already. I'm guessing that's going to be something that's going to be a commonality this early in the school year.
For sure, and so, it's not uncommon for people to get coughs, colds, congestions, that kind of stuff. And KellumConnectMD.com is a wonderful way for us to address it. It's easy, it's quick, it's simple. You can do it when they get home, often when they catch you off guard. It's 8:45, 9 o'clock at night. We'll be happy to help call in things to see what we can do, but there's no reason for people to miss the first part of the year. It's really important that they stay on top of their work, and to miss that early, I think, can be a bit of an issue, and that's a wonderful way for our service to be utilized.
That's right, folks. KellumConnectMD.com. If you enter in the coupon code SCHOOL, SCHOOL, did I spell that right? Yes.
God.
School. I went to McCullum.
Yeah,
hey, I can spell, my friend. Enter the coupon code SCHOOL, and you're going to get $10 off of your visit. KellumConnectMD.com. As Dr. Kellum says, if you're not feeling great, you can do it from the luxury of your home, your office, your car, iPad. All you need is a good internet connection. KellumConnectMD.com. Dr. Kellum, the other day, I had a full physical done and had a full blood panel done. And for a lot of folks, you take several vials of blood, 3, 4, 5, as many as you need. Right. And a lot of people are saying, why do you take so much blood from an individual? But go ahead and explain why some of that happens and the result of that.
Well, it's interesting, and it is a lot of blood at the time that we take that, and often people would get a little bit concerned because it seems like it is one vial after the other. But I will tell you, here at Kellum Family Medicine, we practice and we utilize something called advanced lipid testing. And what's really important about that is traditionally we would understand total cholesterol and bad cholesterol, good cholesterol, those kinds of things. And what we realized with that, Gabe, is that people don't necessarily tend to get better. There's a study that shows 50% of individuals that have normal cholesterol profiles go on to have some sort of heart or stroke event. And that's just, to me, completely unacceptable when we're taking care of our patients. And so we began, really about 10 years ago to utilize these tests. And what they really understand is when people start to begin to have inflammation that tends to disrupt arteries, which leads them to increased plaque formation and clot formation, then ultimately, heart attack or stroke. And what we think is really very important, and what our focus here at Kellum Family Medicine is really catching the disease process way before that time starts. It's hard to really keep people from having a second event. And so if you come in, you've had a heart attack or you've had a stroke, it's so very difficult to make it tough or to make it better to have that or keep you from having that second event. But what I know for sure is that we can do a really good job in making sure we manage these primary events. The difficult part of it, I will tell you, for most of us, myself included, is really living a lifestyle that allows us to keep our numbers down. And there's something in our testing, which is really kind of what the point I wanted to make for all those people out there, is looking at inflammatory markers, because inflammatory markers are made very simple by exercise, by supplements. Omega-3 fatty acids, fish oil is the biggest thing that we can do, and it seems so simple, but it makes a huge difference long term in how healthy our arteries are. And that's really what protects us and keeps us healthy long term.
And it really just goes along with your premise and how you practice, which is let's keep you out of the hospital.
Right.
Let's prevent bad things from happening. Preventative medicine is kind of one of the staples of what you do.
It absolutely is true. And so what happens with that is that often we use less medicine for individuals, which is really, I think, what people really want. It does impart a sense of responsibility on the patients that we don't always push, but I think is exceptionally important, because it does require people to eat better, exercise, and really manage their lifestyle modifications. But if they can do that, what we know is that we can limit medicines, we can prolong life, but we give people quality of lives that are really far better than they are right now. And, personal story, watching my mom unfortunately pass away 6 years ago from diabetes and leg amputations and things like that, it was in moments like that that solidified my belief in preventative therapy, because we gave her all the medicines that were available at the time, and we certainly offered all the things that were possible, but she suffered, and she suffered in a time that was very, very difficult, and that's not what patients have to go through anymore. And if they choose to come to Kellum Family Medicine, it is what we believe to keep you out of that situation and really living a life that's high quality, high activity, so that you can be there for as long as you want for your family, your grandkids, or for whoever else is out there. So we ask people to come in for Kellum Family Medicine. We'd love to go over those testing with you. We'll explain every last one of them to the best of our knowledge. It may only take 2 minutes, but we will teach you what we know. And in that partnership, I think we can create an outcome that's far better than we've ever done in my 25 years of practice in medicine.
And as simplistically as this sounds, coming in for an annual physical.
That's all you need.
That's all you need to do.
Absolutely.
210-945-2121, or visit us online, KellumFamilyMedicine.com. Or you can even go to our Facebook page and you can make an appointment through our Make an Appointment widget there on our Facebook page at Kellum Family Medicine. But an annual visit, just a wellness visit, a well check every year can make all the difference in the world.
A wellness visit makes all the difference in the world if you go to a practice that's progressive in their thinking. If you do the same old things that we've done for 40 years, you're not going to get anywhere. But if you go places where people believe in and looking forward and being cutting edge and doing the things out there that are really making a difference for individuals, that's where we make a difference with that. And that's why we think that at Kellum Family Medicine, that's what differentiates us from a lot of other people. We take the time we have the belief in it, and we certainly want that for the people that come through our doors.
And but you are feeling feverish, if you are feeling bad, if you have a cold, if you have an acute issue that you want to get checked out and you don't want to come to the office, remember, visit KellumConnectMD.com, enter the coupon code SCHOOL, SCHOOL, all lowercase. You're going to get $10 off of your visit. Of course, this broadcast is presented by KellumConnectMD.com. From the luxury of your home. Skip the waiting room, folks, and just use your iPad, your tablet, your computer, your phone to visit a provider here at Kellum Family Medicine. Dr. Kellum.
Yeah.
It's as if we didn't take any time off.
Yeah, I know. Sad.
It's like riding a bike.
Yeah?
Yeah.
Do you know how to ride a bike?
I never learned.
God, you seem kind of uncoordinated.
Yes, when I ride a bike with my kids, I'm like got one of those odd tricycles that holds a manual base 400 pounds. It's impossible to fall on a tricycle unless you're not paying attention.
Yeah, but I want to watch you roll and see if you get up.
That's a big trike, dude.
Yeah, that is.
Anyways, all right, that's going to wrap up this broadcast, folks. Thank you so very much. Remember, stay healthy.